Hi, welcome back to Connected Rheumatology. I'm Dr. Elizabeth Ortiz. So glad to be back with you. As you may or may not have noticed, we took a little bit of a break from posting and putting out some education. We are here in a new office and I'm super excited to come to you, or to get back to you, to talk about all things lupus just in time for Lupus Awareness Month. So we've got a lot of great education coming at you this month about all things lupus, so make sure that you subscribe and like this video. It really helps get this information out there to patients and the loved ones of lupus patients who oftentimes feel confused or maybe aren't getting all their questions answered. As you may know, here at Connected Rheumatology, we talk about all things rheumatology, immunology, diet and movement and mental health and wellness, because it's all connected. And if that is your jam, make sure you stick around and subscribe. So this is the first part of a two-part series where we're going to just basically answer questions about what is lupus. These are the top 10 things that I like to make sure my own patients with a new diagnosis of lupus know and understand about the condition, so that they can be more empowered about their own body, their own disease, the medications that are necessary, the symptoms that they may or may not experience. And so I want to put this out there because I know a lot of people after a diagnosis of lupus, whether it's a new diagnosis or whether it's a diagnosis that they've been living with for a while and still feel confused about what's going on. I want to make sure that these top 10 things are out there to start people thinking and start conversations between people and their doctor. I also think this is a great primer for friends and family and loved ones of patients with lupus. You know, one of the best ways that you can support your loved one as they deal with this new condition is to understand as much as you can about it, be able to talk with them when they want to talk about it, and have a basic understanding about what is happening. All right, so let's just get into it. Number one, lupus is a systemic autoimmune condition that leads to unchecked inflammation that can lead to organ damage. So I know that's a lot, so let's break that down. So let's start with autoimmune. So what is autoimmune? Autoimmune is when our immune system, which is normally set up to help us fight off bacteria and viruses that are harmful to the body, and I know we've all heard lots of information about the immune system because of the COVID-19 pandemic, but our immune system is built to protect us. And in autoimmune conditions, for reasons that aren't entirely clear, the immune system is now attacking our own cells and our own organs. And that attack kicks off this whole cascade of inflammation that, if left unchecked, can cause tissue damage and ultimately organ damage. Now, the word systemic simply means that the entire body or the entire system can be affected. Now, that does not mean that every lupus patient will experience every possible symptom, but just acknowledging that dysfunction and symptoms of all the body's symptoms have been seen in patients with lupus. Now, I want to take just a brief moment and talk about the word inflammation. I think that there is a disconnect between what we mean as doctors when we use the word inflammation, and oftentimes what patients mean to express when they are describing the feeling of inflammation. So when doctors are talking about inflammation, specifically when they're talking about autoimmune conditions like lupus or rheumatoid arthritis, they're talking about inflammation that they can see or test for. So that's going to be things that we can see on a physical exam. So rashes or swollen joints, or hair loss, or there might be specific labs that we can test for that will show us that there's inflammation. Unfortunately, doctors are not very good at appreciating or acknowledging the feeling of inflammation that many patients will come to clinic expressing if there is no objective evidence of it. So if you don't have any joint swelling that we can feel or we can touch, or all of your labs, nothing shows inflammation, that's when we get into a lot of tricky territory. And I think that's where we start to cross wires and not, maybe we're talking at each other, not with each other. And I'm not saying one way is better than the other. I'm just acknowledging that there is this disconnect, that as doctors, we really like to be able to measure things, and we still have a lot to learn about inflammation and how all the different flavors it comes in. And so I just want, as patients, for everyone to understand that that might be why you might not feel so great, but yet you're being told everything is fine. And thankfully, doctors and national organizations are coming along because everyone recognizes that this is an issue, but how best to approach it, we're still working out the kinks. So I just wanted to put that out there. As far as that word inflammation, it gets so much attention these days out in social media and regular media, whatever that means anymore. And so I just wanted to address as best as possible the disconnect that I have seen in the clinic between doctors and patients. Okay, so that's been said. So let's get back to the original question at hand. What is lupus? Number 2. So as I said earlier, lupus is an autoimmune chronic condition, meaning that as of right now, we do not have a cure for it. So when a patient is diagnosed with lupus, for the most part, they will need to be on some sort of medication to control their lupus for the majority of their life. Now, please do not misunderstand me. I am not saying that lupus patients are destined for a life of misery or that they will be forced to take a pharmacy load of medications for their entire life. But I'm simply stating the truth that right now we do not have a cure for lupus. And that is a nice segue into number 3, which is every lupus patient is different. I oftentimes tell my patients I can have 10 lupus patients lined up and all 10 of them will be different. And part of the journey for both the patient and their doctor when you first get lupus is figuring out and learning your particular type of lupus, or your flavor of lupus, I'll often say. And this is really important as you begin to look on the World Wide Webs and the internets and all the Googles when you first get this diagnosis, because I am well aware that there is lots of information out there claiming that a particular supplement or diet or routine cured someone's lupus. And I would never discount someone's personal experience, but I do think it's important to note that everyone's lupus is different. And if you are struggling and haven't been able to get control of your lupus, or are wondering if a particular regimen or supplement or diet change might be good for you, I would really recommend not doing anything without talking to your doctor first. Everyone's lupus is different, and even though lots of people are given the same diagnosis, we, as people who take care of lupus all the time, really understand that we're most likely taking care of different conditions that we're not smart enough yet to understand how to differentiate. So everyone gets labeled with the same label, lupus, but everyone's very different. All right, number 4. Lupus is a condition of flares and remissions. So what does that mean? So when you get a diagnosis of lupus, it is not some slow decline into illness. It is more like a roller coaster. When someone first gets diagnosed with lupus, it is usually because they're in the midst of their first flare. Maybe not even their first flare. Maybe in retrospect, they realize that they might have been having issues even before, but for whatever reason, maybe didn't get medical attention. But usually when someone gets diagnosed, they're in the midst of their first flare, and we're actually pretty good at controlling flares with medications. Some flares don't require a lot of medications. Some flares require hospitalization and lots of strong medications. So everyone's flare is different, but you usually start in a flare. We're able to control the flare with medications, and that can take anywhere from weeks to months to years. Once the flare is controlled, we can then very slowly and carefully start to peel away the medications, because our goal is always to have someone on the lowest amount of medication necessary to control lupus. So you start to slowly peel away the medications. Now, in some patients, the flare comes back right away, and so we have to control the flare again. But in a lot of patients, we find that we're able to successfully peel back medications and keep someone stable, or as we say, in remission, for quite a long period of time. Now, remissions can last anywhere from weeks to months to years, and patients can go on sometimes without medications for quite a while. Now, that doesn't mean I condone going without medications, but the reality is some patients can. And it can be heartbreakingly deceiving when someone is in a long remission, because it can make you feel like the lupus is gone. But it most of the time will come back, and that can be very disappointing. And a lot of times when the lupus comes back, it comes back in the same flavor as it did in the beginning. But sometimes it doesn't, and sometimes it comes back more severe. And so it's for that reason that we always want to prevent flares from coming back and do our best to try to maintain remission. Which then goes into number 5, which are flares are to be avoided if possible. So as I said, lupus does this, right? Flare, remission, flare, remission, flare, remission. And what we want is to have a flare and control it and then maintain remission as long as possible. Now, I've kind of alluded to this earlier in the video, but when we are figuring out or discovering a person's flavor of lupus, you know, maybe they are someone who gets a lot of rashes and joint pain, or maybe there's someone who has kidney problems, or maybe this is someone who always has blood problems, so like their white blood cell count or their platelets might always go low when they flare. That pattern will typically be the way that person flares. So if someone always gets a rash and foot pain, and then when they flare, they'll know that when their rash and foot pain come back, oh, well, that they're flaring. But that's not a guarantee to be like that for their entire life. New symptoms and new problems can always arise. And so it is for that reason that we don't want to tempt fate. We don't want to mess around. We need to keep someone in remission. And that's why staying on medications, continuing to see your doctor, and do all that, even when things have been going pretty well, is super vital so we don't get ourselves in a situation where a flare might happen. Now, I've been talking about medications, but is there anything else you can do as a patient to try to help yourself? Of course, of course. We know, first of all, that sun exposure with SPF, or sun protection, I should say, with SPF and with hats and long sleeves, and so sun protective clothing can help prevent flares, as the UV rays can trigger flares. And we also know stress is huge. Stress is a major factor in lupus flares. In fact, it's not uncommon for us as rheumatologists to see a lupus flare in a patient after a major stressor. So a death in the family, a divorce, a job loss or move can all precipitate a flare. And even positive events that might lead to increased stress or poor sleep can lead to flares. So promotions and a new baby or planning for a wedding. Now, this is not to say that we need to kill ourselves trying to avoid stress or beat ourselves up if we have a flare because of stress. Stress is a part of life. But having a regular, and intentional stress management routine in your life is just as vital at preventing flares as taking your medication. All right, so that does it for this first part of a two-part series on the top 10 things I want everyone to know about lupus. I hope you found this helpful. If you have any questions, please don't hesitate to comment down below. I try my best to get to them. Probably not as timely as I should, but I do try to look over all the comments and answer questions as best I can. Just a reminder that any information I put out is really just for educational and informational purposes, and really to help foster conversations between you and your doctor. Certainly not medical advice, as I can't serve as your doctor myself. And so if you like this video, make sure you give it a thumbs up, ring that bell, and subscribe if this kind of content is interesting to you. We talk about all things rheumatology, immunology, diet and movement, mental health and wellness, because here at Connected Rheumatology, we believe it is all connected. Thanks, and we'll see you next time.